Sorry. Okay, so I think we can start, Tom. So.
Okay, thank you all for being here today. Dear members of the Benin Immunology Society, members of the Federation of African Immunology Societies, immunologists all over the world, dear colleagues and friends. On this special occasion of the Day of Immunology, I'm honored to welcome you to our webinar on the role of immunologists in shaping public health strategies in the pre- and post-COVID-19 era. The COVID-19 pandemic has brought to the forefront the crucial role of immunologists in addressing public health challenges. In this webinar, we will explore the impact of the pandemic on public health strategies and the role of immunologists in shaping the response to the current crisis and also to future public health threats. The discussions will be moderated by my able colleagues, Mrs. Berry Deogracias, General Secretary of the Benin Immunology Society, and Dr. Progenitor Fabian, who is the head of the Education Committee of the Benin Immunology Society. We have a panel of African expert immunologists who will have the chance to introduce themselves and will share with us their insights and experiences on the topic. This is an excellent opportunity for all of us to come together as a community and reflect on the important work we're doing and the impact we can have on society. The webinar is organized under the impulse of the Federation of African Immunology Societies, and we are privileged to have the presence of the president of the FAIS, Professor Patamba Ngom, who will deliver a welcome address to kick off the webinar and provide a Pan-African perspective on the topic. I look forward to an engaging discussion, and I hope we will all enjoy this exciting webinar. I will now leave the word to Professor Patamba, who will deliver his welcome address. Papa, the stage is yours.
Thank you very much, Tomabu and Fabien, for leading, and to all the Benin Society of Immunology members. As the current president of FAIS and a West African, I am honored to be part of this really encouraging trend that we see from West Africa, including Benin is really a great addition to FAIS. Since you guys came in, you've been really active, and I want to thank you all for that, and to thank all the speakers who are coming to spend time with us during this session. I also thank all the attendees who took time to join us. It looks like driving in drones now, which is great. This topic is a really good topic. Immunologists shaping public health strategies. I think public health is a big topic for Africa. We suffer the most in many things, including the numerous infections we have, malaria, TB, HIV, pneumonia, and now the emerging infections, including COVID-19, Ebola. So we really are in the real hot part of these problems in Africa. And I think that as Africans, we need to sharpen our contribution to all of these public health issues. Leading from location, leading from within Africa is really important. One of the things that I think we should also focus on, because without them, I think people start to lose trust, and so they start to lose participation. They feel left out. One of the things is to try and encourage good governance in all of our processes, and to make sure we start to encourage mentoring and supervision of those below us. Because one of the things that I think Africa is suffering from is that we do not have people to look up to mentor us. Often we have mentors from all over the world, but I think we need to do our part. And also we need to encourage gender equity, gender balance, and gender empowerment, the female colleagues, and the youth. The youth are the future of Africa and the world, so we can't leave them out. And I think that we need to strengthen our collaboration within Africa. We do have a lot of collaborations outside Africa, but we really need to start thinking about strengthening our collaborations. I know that there are lots of new great initiatives within Africa. Abdallah here is leading a great one that he probably will talk about during the session. And in Senegal, there is another one that Professor Mboub. So these are like research initiatives that encourage good quality research work and platforms that can be used to, strengthen our capabilities in Africa. And with that, the science is the most important thing. And when we do science, we have to make sure it's good science. Our data must be good data. If it's better not to have any data than to have bad data. So I encourage everybody to remember to put the quality checks within the system to make sure that we build credibility. And with that, I welcome you all and wish you a very happy, successful Day of Immunology event. Thank you.
Thank you, President. I will now leave the floor to Deogracias Berry to start the first round of discussion.
Thank you, Kumabu. Thank you, President, for this nice introduction. I would like to invite now the rest of the panelists to introduce themselves. And I will start by Professor Badu.
Thank you very much. So my name is Abdallah Badu. I'm a professor of immunology and molecular biology at the Faculty of Medicine and Pharmacy in Casablanca. I'm also the scientific director of the Center, Mohammed VI Center for Research and Innovation. That's a new center that I will talk about, which has been started in Morocco post-COVID-19 era. And it's actually the main goal is sort of preparedness to this type of pandemic. I'm also the Secretary General of the Moroccan Society of Immunology and Secretary General of the Federation of African Immunology Society that I'm representing today. And I'm also in the Council of the International Union of Immunological Society.
Thank you. Dr. Mahakalala, please introduce yourself.
Hi, everyone. Hi, my name is Mhlopeni Jackson Marakalala. I'm actually a faculty member at Africa Health Research Institute in Durban and also an associate professor at University College London. My interest in research is in lung inflammation, particularly TB, with the aim of developing host-directed therapies. And it's so great to be here. Thank you so much for the invitations.
Thank you, Doctor. Dr. Shibwana, please introduce yourself. I hope I didn't misspell your name.
Hello, everyone. And dear gracious, you pronounced my name just fine. My name is Mara Chiwana. I am a junior clinician scientist working the Malawi Liverpool Welcome Program. Since the pandemic, most of my work has mostly focused on COVID-19. But post the pandemic, also I have an interest in looking at the intersection of inflammation from infectious diseases and non-communicable diseases. And it's so good to be here. I'm looking forward to the discussion. Thank you.
Thank you. Dr. Shei, I don't know if he's here. Apparently not. Okay. So I think Dr. Shea is not yet with us. So yeah, he's there. Dr. Shea, can you please introduce yourself? You are muted. Can you hear us? I think not. Okay. So
Hello, can you
yeah.
hear me? Sorry
Yes.
for the interruption with the next. Dr.
Yes.
Shea Robert Adamu. I'm from the University of Buea in Cameroon, and I'm a molecular biologist by training, working on parasites, but my work is focused on the development of vaccines and diagnostics. And so I appreciate Prof. Tomabu for the invitation to be here, and it's a pleasure to meet all of the other panelists and the rest of the team in the house. Thank you.
Thank you. So without any further delay, I will start with my first question, and I will address that question to Professor Badu. In the period of the post-COVID, what do you think is the role and the importance of the immunologists in the society and in public health?
Yeah, thank you very much for that question. First, I have to thank the Benin Society of Immunology for leading this event, and of course, the Federation of African Immunological Societies. I think it's a great idea, and we should keep it, annually. I'm really happy today that we would have to discuss between Africans, the role of immunologists in shaping public health, and I hope that we'll come up with some recommendations at the end of our meeting. We need to work together, I think. And I hope that we will come up with some ideas on how to collaborate to resolve our questions within Africa. To come back to your question, I think there are clearly two eras. The first era, which is the pre-COVID era, and then the post-COVID era. And COVID showed us that, in almost all the areas, immunology is extremely important. We saw that, within COVID, there was huge need from the public to understand the immune response and how the immune response works and how to convince people to take a vaccine. Myself, I went out there in Morocco to explain to people with the media how immunology works and how the immune response works, and how when you give a piece of a virus, within the vaccine material, it's not very different from when you have a natural infection. And actually, immunologists were able to convince a huge part of the public to understand how the vaccine works and how the immune response is mounted just either through the regular immune response, natural immune response, natural encounter with the virus, or through the vaccine. So yeah, I have to say that without now doubt, the immunology is extremely important, not only for infectious disease. Now in cancer immunology, and myself, I'm a cancer immunologist, so we could talk about that later, as immunotherapy, in autoimmune diseases, and many even in neurodegenerative diseases, in many diseases where we thought the immune system does not have a role. Now immunology is playing a big role. So back to what I said in the beginning, I think it's really time for us as Africans to start. Of course, we have no problem on collaborating with labs all over the world, but we need to find ways also to have our own collaborations, strong collaborations within Africa, to be able to eventually, face a pandemic such as the one we just, had. Fortunately, Africa did not suffer a lot from it, but we might have others which could be, more difficult. Thank you. We cannot hear you. We cannot hear you. You're muted.
Thank you. Actually, the question was the pre-COVID, the role of the immunologist. So I will ask Professor Ngo his opinion about the role of the immunologist and in public health in pre-COVID. I don't know if he's still with us. Professor Patamba.
Oh, oops, sorry. I didn't realize you were. I think mine.
We can hear you now.
I'm trying to put my video on. Yeah. So, pre-COVID, you're asking. Can you repeat the question again?
The role of immunologists, the role and the importance of immunologists in public health.
Okay. Yeah. So, as I started to discuss in my introduction, immunology drives a lot of areas in our lives as Africans that shape our lives. Because, for example, infections make people ill, and it doesn't only cause individual problems in people, but it also extends to our economy. As you know, Africa, manpower is one of the things that drives a lot of our economic development. And I think quite often people focus on human immunity, which is very important. But in Africa, we have a more complex situation. So, for example, veterinary immunology, there are lots of communities that depend on their herds and their animals, and both for food and for income. And I think the role of immunologists in protecting and in the healthcare of both humans and in animals indirectly supports good economic development for Africa. I think most will agree that a lot of our problems are also based on the fact that we are limited in resources. I'm sure there are other more complicating things, but it's a good start. And I think immunologists in Africa need to approach these challenges by making sure we put our agenda, the things that are most relevant to us, infectious diseases, but also emerging areas. For example, we are not immune to all these other related diseases that we previously didn't consider African. And it's good to see people like Abdallah working in cancer immunology, because there are a lot of cancer impacts the populations of Africa in ways that were previously not even looked for. And now that we are looking for it, we are seeing that cancer is as important in Africa as it is in the rest of the world. And so, yeah, I think we do have a big role to play, and we should start stepping up.
Thank you. So I will address this second question because, like, as we know, immunologists, they can't work without the tool, and they can't provide any immune solution without improvement. So I will ask Dr. Marakalala, since he's working in immunotherapy, I think also. How does the relation immunology and public health lead to the development of vaccine against the infectious disease? What do you think?
Yeah, thank you so much for that question. So is the question how immunology leads to development of vaccines and therapies against diseases? Just to clarify.
Okay.
I was just asking.
Yeah. How
Yeah,
the relation, because like immunology cannot act without the society and everything. So
Sure.
how the relationship between immunology and actually public health leads to the vaccine production and also address the specific response to the infectious diseases?
Thank you. That's quite a very interesting question. So first, maybe to start, I could tell a bit about the interest of immunology at population level before COVID, in particular in a space where we work. For instance, I used to be a lecturer at the University of Cape Town, lecturing medical students. So they would do a lot of courses, disciplines that are actually integrated together to make one, for instance, exam. And immunology would be like 12 marks. And when I would talk to students, actually, a lot of them would say, actually, put immunology at the end. So that even if we didn't finish because of time, we know that we don't lose mark because immunology is the most difficult. A lot of acronyms not understood very well, and also very difficult that actually for the little share of mark, things that we really need to answer. But also earlier on, there would be lack of practicality amongst those who are actually starting to think, what is immunology exactly? But this is early, first year, second year, but you meet 6th years now in medicine, 5th year. When you actually tell them you're an immunologist, they'll tell you, my greatest regret was never taking immunology serious, because now I see applicability as I get to clinical aspect of medicine, like how host-directed therapies, how vaccine development requires one to understand how the immune system mounts specific actually responses to try and counteract pathogens. So that's a summary of how I feel actually the understanding, both at people, these are medical students, not to even start talking of people, laymen in the street. So first, I'm glad these events like this are actually playing towards that advocacy and awareness for us to recognize the value of immunology in terms of developing tools that we need to sort of fight diseases. But then again, like quickly giving examples of TB. TB only has one vaccine that's over 100 years. It's efficient in children against severe diseases, but in adults, actually, that efficacy goes so down, and we've been having a lot of clinical trials failing. So because of lack of new products that have been coming in diseases like HIV, we've been doing a lot of immunology trials in vaccines. We haven't had a success as yet. Malaria, we know because of antigenic variations, we're actually still failing to get a very strong vaccine. So in public, when news come out that actually vaccine was trialed and it never worked, so it looked like immunology's value is actually really overshadowed in this case. So, but perhaps trials are there, because of course, I'm not going to talk post-COVID, but I'll talk of other things on how we can learn now the value of immunology and how actually a person in the street now has come to be an expert in immunology because of how immunology was really central in understanding dynamics of vaccine efficacy, herd immunity, how actually like rapid development and testing of vaccines were taken into consideration. But against diseases, the question I think you mentioned also doesn't center on a single disease, but also going forward against other outbreaks that would occur so quick that even our own immune system cannot actually counteract such disease. Very interesting. So the role that immunology plays basically is very key, that you have to understand how actually one mounts a proper immune response against an invading pathogen and see what are the aspects, for instance, components on the surface of the pathogen that could be utilized to trigger a good response that could be elicited by our cells. So the understanding is both on the host and as well as the nature of the pathogen itself. And then also to understanding details of, I think, host-directed therapies, because immune system is good, but it can be too much and hyper-inflammatory, leading to our own organ damage. So those aspects need to be understood so that we can develop host-directed therapy, like immunotherapy, for instance, that you mentioned, that could be used to dampen a bit of damaging aspects of the immune system. So all those dynamics need people to understand three things: the pathogen, the host, the immune system itself, and as well as exactly what are the components that you can target. Because the problem with targeting our immune system, you target something that may be causing inflammation, but it's also important for other aspects of our body. So it's a very interesting area on how you regulate these issues. That is a very exciting field that we find ourselves in. Thank you.
Thank you so much. Dr. Shea?
Yes, thank you very much for the opportunity. I would ask for permission to pull my video off because the bandwidth is really a problem. So I've been having to switch between service providers to even see if I can remain in the meeting.
Okay.
So talking about the importance of immunology and immunologists in shaping public health strategies, I think I would first of all begin by talking about the fact that I think Prof. Pat Tamba talked about it when he highlighted the fact that Africa bears a big burden of the global infectious disease burden. And I think when we look at it from the perspective as immunologists, we would understand that there is a big role that we have to play when we talk about public health. I think the goals of public health are to promote health and prevent disease. I think those are the two key things. And so if we want to talk about it in the perspective of preventing disease, we have to look at how the host, I think the last speaker just talked about the importance of the host, the pathogen. We look at it in terms of how important an intact immune system is in preventing disease. And so I will talk about the importance in three key aspects in the development of interventions. I think we have already seen the importance of vaccines in as a public health intervention. I think if we're talking about the three key public health interventions, we can talk about vaccines, we can talk about AMR and WASH, but vaccines, you see that vaccines are a key aspect of public health interventions. And so we can look at it in terms of the important roles vaccines have played in even the eradication of some diseases. I think we can talk about smallpox. I think the world is also now on its way to elimination of polio, even though we still have outbreaks here and there. So we can talk about vaccines, both prophylactic and therapeutic, and we can also talk about how the important our knowledge in immunology has helped in developing vaccines that are more efficacious. If you look at the diseases like I think pneumonia caused by pneumococcus, our understanding of how immune responses are not mounted properly to polysaccharides, for example, has helped in the development of new vaccines. In this case, we're talking about conjugate vaccines, where we are not just presenting the polysaccharides, but we are conjugating the polysaccharide to proteins with our understanding of the immune system. And then we can also talk about the understanding of disease mechanisms. And in this case, I can talk about the fact that with good understanding of disease mechanisms, immunologists are now moving. I think this is one of the areas where I'm really interested in, moving away from the classical and empirical vaccine design, which is based on trial and error, to a more knowledge-based approach. And I think here we're talking about making use of information on immune protection correlates to be able to design better vaccines based on the information we have on how the immune system will act in particular diseases. And we can also talk about the development of diagnostics. I think diagnostics are a very key aspect. I think we have seen how how important vaccines are, but I think that sometimes we tend to neglect the role of diagnostics. And the truth is that without proper diagnostics, it's difficult to even talk about how effective the other interventions we are bringing in, maybe like vaccines, maybe like drugs and all of that. So I think I would just end my submission here, and I would thank the moderator for the opportunity.
Thank you so much for your input, Dr. Shimura. I know that these last years you have been working on COVID, so I will address these questions especially to you. So what were the challenges in developing the vaccine during COVID-19 period?
Thank you, dear Gracious, for that question. I think unlike we can talk about how easy it was to develop the COVID-19 vaccine, not easy in a sense, but that to the public, it mostly looked like it was a fast-track process, and we're able to get to a vaccine quite quickly. And I guess that also raised to some of the issues that we had, even with uptake of the vaccine. But I think even then, the challenges were still there in developing the vaccine. So making sure that the vaccine platforms that were actually being tried worked. So obviously a lot of work had gone into the development of all these, the mRNA vaccine platforms, which you now know work very well, the adenoviral vector platforms, which we're now using. But I think in that moment, actually getting these platforms to work, the funding to actually get enough vaccine doses to everyone, and the getting the vaccines to the people, especially in places like in Africa where we had to wait quite a while for the vaccine. So I think those are still some things that we need to fine tune in terms of developing vaccines that can be that are on great platforms, but can also be used in places like here, where, for example, it's very hard to have a -80 freezer and be able to distribute that vaccine while keeping that cold chain storage. So I think those were some of the issues. But what I will say is, overall, with the COVID-19 pandemic, I think what we really saw was good development of a vaccine that was it was the right response to the pandemic, and we're actually able to get that vaccine out. And I think it's important for us to think about the challenges for next time, because maybe next time we might not be as lucky to have that things are working and we have a vaccine in a year, and we're controlling things at that point. Thank you.
Thank you so much. I have one question from the chat addressed to Professor Badu. So could you maybe describe the mechanism that link immunologists with the stakeholder in Morocco, and how these were affected by the COVID-19 pandemic?
So the question is addressed to how the immune system or the immune response is linked to what does he mean? Which stakeholders he is talking about? Do you know?
Not really. I think it's the question was addressed by Tomabu. So
yeah, Tomabu, he can explain further. So
yeah. So maybe I can precise my question.
Yes,
the question
yes,
is
please.
Rather how immunologists are connected to people that make decisions, because before to be able to impact public health decision, we need to connect with government or any other institutions that are involved in decision making. So how does this work in Morocco?
No, that's a great question. Actually, COVID-19 has changed completely, the vision, even of the governments. So the governments were stuck. They had to listen to scientists, and this is how it went. So they had to make committees, and in these committees, for the first time, they had to have immunologists as well. They had to have virologists. And we were in the media all the time. So I was like in media 3-4 times in all the televisions and on the channels. Not only me, molecular biologists, virologists, to explain to people. And they were obliged to listen to us because, they had no idea of what's happening. So they had to listen to us to understand how the immune system works, whether, and for instance, a natural infection would be the equivalent of a shot of the vaccine, why it will be the equivalent of one, or for instance, the vaccine is completely different. The way the vaccine works is different from the natural infection. So many questions. So we were actually having a lot of questions, and we were almost deciding everything. So on how things should go, so with which vaccine we should order. And I think your question is really great, Tomabo, because it's leading me to another side, which I want to share with you. So the idea after COVID-19 was to initiate a big center, which is called, Mohammed VI Center for Research and Innovation. I was actually named as a scientific director of the center. And the idea here is really to have Morocco and Africa prepared for eventual future pandemic. So I really encourage and, it is a call for all of you, whoever has an idea, a good idea, and wants to collaborate in this center. There are, I would say there is budget, there is space, there are human resources, and the idea is really to have, a platform of RNA vaccine from A to Z, from research and development to the production, to upscaling the production. Also, we're working to have another platform, we call that modality, which is recombinant protein modality, and also another one with recombinant proteins. So whoever has a project in which we could collaborate, and we could go until startups or even until enterprise, creating a society, a real society. So this is not a public project. This is a non-profit Moroccan organization, which is not public, so it makes things go, faster. But in the same time, it's run by the government, and it is shaped, and also, it's given a big budget by the government. So the impact of COVID-19 was during the pandemic. They were obliged to listen for the first time to scientists, but also post-pandemic era, which is really, and this big center is run by scientists for the first time. It's run entirely by scientists.
Thank you so much.
So just to thank you for the answer to the question and the great opportunity you are offering for collaboration. But I would like to extend the question to the other countries to know if there are also such great opportunities that we have in Morocco.
Yes.
So I know of one initiative in Senegal, Professor Mboub. Are you aware of that center? It's like a research hotel. I think it's pretty similar to Abdallah's, but I'm not sure how well they're doing in terms of engaging the real community in Africa to get things going. Abdallah, I wonder if you have a strategy to make sure that this is really heard all over Africa, to engage people. Have you started to make that kind of breakthrough?
Yeah, this is a key question. We just started 4 months ago, so we are going to launch officially the center in June. So, but the idea is we're going, of course, to have a website, and we will going to, to have you visit us for sure, and to have FAIS visit us. So we're starting all collaborations. I'm actually the scientific director, so I started to invite people from all over the world, but Africa is certainly within the project, and it's one of, the goal of Morocco. How is the relationship of Morocco with Africa, and yeah. So as I said, of course, we will launch some, some more aggressive, ways of getting heard, but we're just starting. But for sure, we'll organize some other events. And actually, during the week of June 12th, from June 12th to 17th, we have a week for this center, just to launch the center. And if someone wants to come and give a talk, you are welcome. Somebody who wants to come and give a talk and eventually have a collaborative project, he is very welcome.
If nobody hasn't got a chance, I would like to just push this a little bit more.
I agree.
Okay, so Abdallah, I think it's really important to start by clearly defining your plans to have a quality service, a quality product, because one of the things that the rest of the world wonders about Africa is credibility. I know if we, for example, you could think about having accreditation to international bodies that recognize your facility in such a way that your facility can start to host specialized testing. And that's a big market, for example, in biotechnology. You can start to have great clients, but the bottom line, the foundation of anything from Africa is credibility, quality. What are you doing about that?
Yeah, no, this is a really important question. And just to give you a glance of what we're doing so far. So I have 3 collaborations with Yale University. I have 1 collaboration with Germany and another one with France. So the idea here is we're proposing 3 things. We're proposing knowledge, we're proposing services, and also we're proposing products. And of course, the quality with Yale, for instance, I mentioned Yale just for you to understand. Yale University, we have an anti-fungal actually project with Yale University, and we have to set up, things for them. And once we got all our tests, in good shape with, quality norms, of course, the idea is we will sign a material transfer agreement with them, and we will start to test their products. This is one of the ideas we have with them. So yes, this is what you're asking is, of course, a very important question, and we're very aware about it. And of course, just to tell you how we're going to set up all these modalities or these platforms, this is mainly with, I don't know if you guys know Sartorius, and Sartorius in Germany is the society who actually provides Moderna and BioNTech with all the equipments, and this is the company we're working with. So yes, this is a key question, and we're aware about the question, and we are willing, and we will do all what we can to have these high standards, because our goal is not to keep this within Morocco. but to touch the international, of course, starting with Africa and eventually go further, in other places. Because as you said, in Africa, we have a great potential, and this is all what we need. We need to start working together. And I think we have all the ingredients we need in this center to start something interesting. And this is why I talked about the public thing. It's completely different. The university I'm in right now, I mean, the public university is completely different from this type of project. So the public universities are usually slow, all these administrative things. I think we all suffer from it. This is completely different. Of course, we're gonna encounter other difficulties, but let's hope to face one by one and remove one difficulty from another to try and reach the objective.
Thank you, Professor. I think we will continue with the discussion. We can, we will not stop the discussion, but I think we should continue with the agenda. I saw Dr. Marakalala. You were raising your hand. I don't know if
well, yeah, so
same
I'll just be brief because
okay.
Professor here asked if other countries had a different experience or anything to add. So as I said, there was little interaction between immunology and potential stakeholders, except that our institute here, which is called Africa Health Research Institute, would actually approach government ourselves, our local government, and actually present data from our population. So we usually follow about 30,000 people or so looking at hypertension, diabetes, TB, and HIV. So when we actually presented data to government, they started actually getting excited because when they give report, we could even give them data of the local government that's relevant. So that's how it was. But with COVID, how this relationship with stakeholders actually took a turn, or actually how it was influenced by COVID, it actually got better. So first, I think many people may be aware that of the Omicron, the emergence of Omicron actually was discovered basically in South Africa, and people in the world were actually crucifying South Africa as actually not being allowed to enter, whereas actually it was already circulating. But because of the genomics actually surveillance that was supported by government, actually in our institute here, also called CRISP, we managed to really do a daily surveillance of new every samples we got. And another thing was that we also had a South African young PhD student who was the first to grow the virus itself, SARS-CoV-2 in the lab. So we started having people throughout the world asking for the samples from here. So those actually, I have to say, someone mentioned that because of that interactions we had, government started getting a lot of advices from immunologists in terms of addressing communities, addressing media, and also, like all these, including we had a vaccine that came from AstraZeneca, and the night before it was started, it could be administered actually. There was actually a report that actually it was investigated to have actually had to be about to expire first. And secondly, the efficacy was a bit too low, having been tested outside, but it was quickly done in South Africa and realized that in our population, the efficacy was a bit too low. And such decisions by government were informed by interactions with immunologists. So I have to say COVID has actually enhanced our ability to interact with government, and to government, including communities, to start taking immunologists seriously. So that question, thank you for that, yeah.
Thank you so much. I will now leave the floor to Dr. Kodinoto to lead us with the post-COVID area.
So thank you, Theo Gracias. I think this is a really, really perfect transition now for me because I don't need to talk a lot. And I mean, it's a really, really great initiative, Professor Bado. I mean, we can really learn from Morocco and then connect here for future project, and then envision how we can already prepare for future pandemics. And I think this is now the time to really understand, because I mean, Patamba was saying, so we need really great data, reliable data, but then we need to understand also the immunology of this virus as well. And then, I just had a look in the publication about COVID, SARS-CoV-2, just during the pandemic, and now after the pandemic. and then the publication, the number of publication really dropped down. So then my first question about the post-COVID era will be addressed to Dr. Chibwana. So do you think, Dr. Chibwana, that we already learned everything about the virus since now the publication dropped down? Do we really learn everything about the virus? Then we can prepare for future pandemic. Do you think so?
Thank you, Fabian, for that question. I firstly, to address the drop in publications, I think unfortunately this is how it is gone, that we were all doing our various immunology work, and then the pandemic came. So we kind of dropped everything and went to the pandemic. And now I guess people are back to the work that they were doing and trying to push that forward. So maybe some of that work is not even is not yet at the level where it can be published, etc. So that can contribute to the drop in publication that we're seeing. And secondly, I don't think we've quite learned everything that we need to from COVID. I think there's still room for us to learn quite a lot. There's still room for us to be able to prepare very well for the next pandemic, if and when it does happen. And I think what's happening, unfortunately, is we're all kind of moving back to what we do normally and doing COVID work in the background. But I think especially for places like Africa, and just like Professor Baju said, that they're now looking at the center in Morocco. Those are very good initiatives to make sure that we continue learning from the pandemic and then apply that to any other thing that we might need to respond to. Yeah, I think that's my answer. Thank you.
Thank you. I mean, Dr. Marakalala. So, I mean, South Africa has been one of the impacted country, right, about the COVID. So, and then you are an expert of TB. So, do you think that we can learn from other disease, like TB, for instance? So the logistic behind TB. I mean, so Dr. Chibwana already mentioned at the beginning that also the logistic behind it is quite difficult. So do you think that we can learn from other diseases like infection like TB to really be prepared to tackle the future pandemic?
Yes, thank you so much for that, Dr. Proginato, about that question. So basically, in fact, I have to say, when people said the biggest scare that we had in Africa, because the pandemic, actually at the beginning, the effects were more in the developed world too. So people were scared whether actually the low, because of our severity of HIV and TB here in sub-Saharan Africa, for instance, that actually when the pandemic really comes, that would be like, is it going to wipe us all or what? Surprisingly, actually, we found that actually most of African countries were actually the less affected compared to their developed counterpart for the first time. Possibly why actually this has actually received so much attention globally for the first time with so much collaboration and funds. So it's one, I think, outbreak that affected the developed world more. And I would argue that part of how countries like South Africa, countries like all these countries like Kenya, Zimbabwe, and so on, how we sort of perhaps did well handling these was because of our own previous disadvantages on having a lot of diseases that created us to know exactly how to, so how we tackled HIV TB, we already knew how to, you do case tracing, you already know how to approach rural areas to deal with communicating with people there on issues of importance in health, right? You also have nurses who already have systems of collecting, of interacting, integrating with communities. So those kind of things, including facilities that were specifically created for HIV, for instance, in deep rural areas, those themselves, I think, were repurposed, including nurses, including some of the funds that were actually meant for biosafety level 3s in TB here. We had to repurpose our biosafety level 3 here to do COVID testing. People that were hired to work in our projects in TB, for instance, including funds. Luckily in our lab, we also have some Wellcome Trust funds that actually Wellcome Trust gave us a go-ahead that we could actually be allowed to repurpose those funds to address COVID-19. So if you think about the disadvantage that existed because of the existence of HIV and TB earlier, it has turned actually for us to know how to really tackle COVID-19 better because of such resources. So I would say actually TB itself alongside HIV, especially in South Africa, seeing that we have a lot of co-infection on the two, has actually primed us to know how to address these things at population level, to integrate and discuss with communities, to engage government, and to also repurpose services and also centers.
Thank you for the great response, great feedback here. So, Dr. Robert, I hope you are still with us. So what do you think as a host parasite interaction immunologist, and then you are working with onchocerciasis, so with helminth infection, because people assume, or even there have been some assumption that in a region where helminth are endemic, so the public health system are less affected by COVID. So this is some assumption. So what do you think? Can we also learn from other pathogen like helminth? So the way they hijack the immune system, then to prepare for future pandemic as well.
Can you hear me?
Yes.
Okay, so I think I agree with Dr. Marakalala from South Africa, who has talked about how maybe other diseases has helped in preparation for COVID. But one thing I just want to add is that COVID has helped to give us new platforms that are better working. And with regards to maybe my little experience with helminths and vaccine development, one of the things I can say is that I think the information we have about helminths is that they cause a lot of immune suppression, and so they tend to divert, to polarize the immune system towards some other kind of response, Th2 response, which are not very which favor viruses. But I think that that's not what we actually saw in Cameroon at the moment. I think one of the things we realized is that the mortality in Cameroon was very low. The mortality in Cameroon for COVID was really low. And I think it goes back to the question you asked about whether we can learn enough about the virus. The truth is that we are still at the stage where there are a lot of questions surrounding why COVID-19 had the little impact it had on African populations. It could be due to the exposures we'd had with previous diseases, but it still calls for a lot of research. So there are a lot of things we can still do. And I think that one of the things I'm also doing as somebody who has been doing work on helminth vaccinology is to gather the little knowledge I have from helminth vaccinology to see how to design better vaccines. I talked earlier about correlates of immune protection and how it can help us to develop better vaccines. And so in this case, we're talking about the rational development of vaccines that are more potent. So this is how we can make use of the information in helminth vaccinology to be able to design better interventions for COVID in the long run.
Oh, thank you a lot. I mean, we are talking now about other infection and helminth, and so there is one question in the chat which they need attention. So from Ketolo Sulu, and then the question is, so we know that mental health is often at the back row, yet many infectious diseases affect the neurobiology, right? So dementia and so on, depression and so on. So what role can African immunologists play for the better understanding of the intersection between pathogen? So which means connection between helminth and COVID and then treatment outcome. Maybe this question I directly address it to Professor Badu. So since you are also working with cancer and so So we have so many infection that intersect or then interconnect with COVID actually, and then especially in tropical regions we have helmet, and so the question was, so the role of African immunologists to better understand the connection between those different pathogens and the host, and then the treatment outcome.
Yeah, actually, I had the same question, but I had a lot of questions in Morocco here from public, sectors about why Africa is less affected than the rest of the continent. Can you hear me?
Yeah, we can hear you.
And actually, I was surprised that Dr. Mara Kalala, brought a different actually answer. And so initially I thought that it's mainly because of eventual or potential cross-reactivity with other infections, as you just said. But when you think about it, there are actually two sides. There is South Africa and the rest of Africa. South Africa had a lot of cases and they dealt well with them. But the rest of Africa has almost no cases, or very few cases, although the vaccine were very few vaccines actually involved. So it has been actually shown clearly in many countries, like in the United States and also France, and I think Israel, that even in people who have not been infected by virus, they found some CD8 positive T cells with cross-reactivity to COVID-19, showing that some people has T cells which could recognize SARS-CoV-2, probably from previous infections, maybe from SARS-CoV-1, or cross-reactivity with other viruses. And I thought that was probably the closest hypothesis to why Africa was not that much affected by or impacted by this pandemic. But to go back to your very important questions, I was hoping to see some studies which would either confirm this or reject this hypothesis. Unfortunately, this is why we need to work together, because we could not understand why Africa has. When you look at the COVID pandemic throughout the world, I was looking at that every day. There are the rest of the world, and then there is a very small curve for Africa. For all to Africa, the number of cases and the number of deaths were very, very small compared to the rest of the world. So yes, your suggestion is very, important. The role of immunologists in understanding and in, bringing answers to this type of questions is very important, and it is time, I think, to start and shape some huge projects between us to try to understand immunology within Africa for infectious diseases. But believe me, there are many other, diseases such as cancer, which soon we're going to be facing. And believe me, when you look at the immunotherapy, for instance, one patient, sometimes it costs $300,000. It's just unbelievable, and we could not afford it within Africa. So I think it's time for us to look for alternatives and to look for some, and this is what we try to do in my lab, actually. We're trying to look for ways to, I don't know if you're, ways to block or to attenuate or to inhibit these immune checkpoints in order to enable the immune system.
And we have some issue with Professor Badu. So I think, yeah, so
to attack cancer in ways other than done in.
Okay, so thank you a lot. I mean, we lost a little bit the last few words you said, Professor Badu, but then I think Tomambo wanted to say something about that topic, this question.
Yeah, sure. I really love this topic, and I really love what you said, Abdallah. Yes, in my personal opinion, I call this hypothesis, but there are a lot of line of evidence supporting this hypothesis. We believe, of course, that co-infections are playing a role, and with malaria or with almonds and a lot of other diseases that we have in Africa. But the hypothesis on the cross-reactivity, at least from the data we have in my lab, not yet published, is that it's maybe not playing a key role because we have really little cross-reactivity compared to infection or vaccination. So this might be minimal, marginal effect. So cross-reactivity is maybe not the main thing that has contributed to the protection, eventual protection in Africa. But another thing that is important to mention is that recording structures are really weak in Africa. So this may explain why we have so low numbers. We do not have good testing capacities. We do not have good recording capacities. So maybe if we compare to the rest of the world, we may not be able to say for sure we have this amount of infection in Africa. This is something that we need to be careful with. Another aspect which is really important is that the at-risk population, I mean people over 70 years old, is really small in Africa. So even if we have a lot of infection, we may not have that much mortality. And since we do not have the capacity to record all infections, so this might play on the numbers we have. So all these aspects, in addition to almond, malaria, all the co-infection that might play a role, could be one of the reasons why we have so different numbers.
So we also have, we want to have some few words from Clarissa. So she wants to add something about that.
Yeah, thank you, Tomabu. I think that was some issues that you raised, I would have also raised, but I mean, maybe just one general comment, because I mean, your title is Role of Immunologists in Shaping Public Health Strategies in the Pre- and Post-COVID Era. I think maybe it's interesting, just to reflect what was happening also in Germany, where we are situated, so Fabian, Deo, and I, is that in the pre-COVID era, I would even say immunologists in public health didn't play a role at all. They simply, delivered some vaccines, but even that was decoupled completely from any kind of understanding of immunology in the public health sector. And it is absolutely true. This has completely changed in Germany. And we have now, for example, the president of the German Society being very active also in the public domain as such. But I think it's so shaping public health and public health research. It's really important to mention that we need also interdisciplinary research between immunologists and public health specialists. So I think this is a point I would like to make in general, is to think about interdisciplinary research and to really, because if we want to stay sustainable, we need to develop also, for example, such novel vaccines. I mean, we haven't discussed vaccine hesitancy. That was in one of your other seminars already discussed, but that just shows how important it is to work with public health specialists, but also with social scientists, right? And then maybe more specifically, and also an idea, like Tomabu said, I mean, for sure, there is a very different situation. COVID hit in a lot of places of sub-Saharan Africa, people with an immune system which was most likely not comparable to an immune system in high-income countries, like in Germany, for example, right? So I think it, And we don't have really good comparative studies in immunology that really compare very, very meticulously and standardized immune system reactivity, composition, etc., between population on the population level. I think there is a big chance there. I mean, there's now, of course, on the genetic level, there's a lot going on within Africa, and there's also epidemiologic studies on a population level. But I would really call also for immunological population studies. And then my very last comment would be to think about also, so this is something that we're really interested in and working on a lot, is how maternal exposure during pregnancy actually shapes the immune system already at birth, right? So you're born with potentially born with a very different immune system depending on the exposure during pregnancy. So I think that, taking all these considerations, especially for the African context, into your, the discussion would be fantastic, I think, yeah.
So thank you, Clarissa, for such important input into the debate. So I would like, since we are in the post-COVID era right now, and then we do learn, I mean, we are experiencing a lot of the so-called long COVID. So which actually affect approximately 10% of the affected individual. And then I think today is the main COVID related burden of our health system, since we are talking now about health system. So I would like to ask Dr. Chibwana about the long COVID, because people are experiencing this, and then 10% of all affected individuals is really huge. So what do we immunologists know about long COVID? What do we know about long COVID, Dr. Chibwana?
Thank you, Dr. Fabian, for that. So I think from long COVID, that's one of the things that came up late as the pandemic was progressing, and we realized that some of the people still had some of the remaining sequelae from COVID, so fatigue, brain fog, and all those other symptoms that people are experiencing. And I think quite 10% is a good amount of, still a good number of people that has been affected. And I think unfortunately in places like Malawi, for example, we haven't really had a big focus on long COVID, picking it up, diagnosing it, etc. That has also been quite a challenge, because it's also quite unclear in terms of like how exactly do you diagnose it, and with the strain already on health systems, it's something that has gone a bit under the rags. But I think we do realize that that's a big problem, and it just goes to show again that we still haven't completed learning about the SARS-CoV-2 and just how it affects our immune system and the long-term impact that it can have. And so I think that's still a place that we really need to consider and look at the lessons that we can get from there, and just how we can not only apply that to COVID, but to other diseases as well. Thank you.
Yeah. So thank you a lot. So Professor Badu, since you have a fantastic unit now working to prepare future pandemic in Morocco, so do you also, or did you even already implement into your strategy so to tackle this, or at least understand as immunologists the long COVID? What are the causes, and then do we have any diagnostic and treatment option for long COVID? I mean, if you have it in your strategy.
Well, actually, as I said, we just started this center like 4 months ago. Long COVID is a very complex, disease or syndrome, and there are, multi, how to say, mechanisms involved in post-COVID, and a lot of patients are suffering from really different types, I would say, of long COVID. So no, we don't have an answer yet to all what is happening in long COVID. We have in the hospital some people looking at what's going on within the central nervous system, which is affected a lot by COVID. People think that it is affected only by secondary effects of vaccine, very rarely, but also, infection with COVID affects the, central nervous system. But we don't have a complete understanding at this time. I think nobody has a complete understanding of the long COVID. And the goal of the center is indeed to have an area of research, including immunology, but also an area of research and development to really production. And this is the goal of this center. But to answer your question directly, no, we don't have a real understanding, and it will take a long time to really understand what's going on with the long COVID, I think.
Thank you a lot. I think we are supposed to end the webinar at 5:30, but then we'll extend some minutes, so the debate is quite interesting. We have now Professor Yapo Crizoid with us. So we welcome you, and then thank you a lot for being with us. So I mean, maybe the question that I will ask you directly is, so as the COVID-19, since we are now learning from COVID and then prepare for a future pandemic. So when the COVID-19 surge, so there was a kind of confusion in the role of immunologists and also virologists in the response to the disease. And then as immunologists, they step in as virologists, and then vice versa. So how far are we prepared now to avoid such confusion for future pandemic? And then do you think that immunologists should be integrated in health policies? So maybe I'll little then translate this in French for
Thank you very much.
donc
Bonjour à tous. Je suis très
merci.
heureuse d'être parmi vous.
Merci beaucoup.
Merci la Société béninoise d'immunologie qui m'a invité donc à ce webinaire. Effectivement, par rapport à la pandémie à COVID-19, il y a effectivement la place de l'immunologiste qui pose problème dans certains de nos pays, parce que les virologues, plus ou moins les microbiologistes, pensent que la pandémie à COVID-19 est plus un problème de microbiologie que d'immunologie. Mais finalement, on se retrouve avec des personnes qui travaillent sur la COVID-19 en n'ayant pas de base en immunologie. Et du coup, on se retrouve donc avec des études qui quelquefois posent des problèmes. Et je pense que c'est une pandémie qui n'est pas plutôt multidisciplinaire. Il faut que tout le monde y trouve son compte, que ce soit l'anthropologue, le virologue, que ce soit l'agent de santé communautaire, que ce soit même les politiques. Parce que quand vous n'avez pas tous les instruments ou toutes les structures pour travailler, il va de soi que vous ne pouvez pas exercer votre art. Donc, il serait vraiment intéressant que tous les acteurs se sentent concernés par cette pandémie, comme toutes les autres pandémies d'ailleurs, pas forcément la COVID-19, et que dans le futur, on travaille de façon collaborative, que ce ne soit pas une pandémie ou une affection qui soit ciblée sur une discipline bien précise. C'est un travail collaboratif qui doit permettre donc à chacun de nous de pouvoir trouver sa place. Et surtout qu'en immunologie, nous n'avons pas beaucoup de personnes qui s'intéressent à cette discipline. En tout cas, en Côte d'Ivoire, nous n'avons pas beaucoup de personnes qui s'intéressent. Les jeunes sont un peu frileux par rapport à l'immunologie. Et je pense que ce sera l'opportunité pour qu'on puisse, au niveau des États, à l'intérieur des États, faire la promotion de l'immunologie pour comprendre un peu les bases immunologiques de toutes ces maladies, parce que les bases sont immunologiques, pour qu'on puisse comprendre cela et pouvoir travailler dans ce sens. Il ne faut pas aussi oublier qu'on a, en dehors des maladies infectieuses, On a des maladies aussi qui sont non transmissibles, non infectieuses, et qui pourraient être aussi un challenge pour nous pour démarrer des prémices en vaccinologie. Je m'intéresse effectivement à tout ce qui est envénimation. Et vous savez que dans ce cas, nous sommes dans des pays agricoles, donc où 50% de la population vit pratiquement dans des zones rurales. Donc, c'est intéressant pour nous de penser donc à mettre en place ce genre de structure-là dans nos pays ou choisir des régions sur notre continent pour donner déjà des prémices de cette notion de vaccinologie qu'on nous donne, parce qu'effectivement, on reçoit des vaccins d'autres pays, mais au niveau de l'Afrique, qu'est-ce qui est fait au niveau de l'Afrique? Je pense que ce ne serait pas déjà mal de pouvoir commencer par ces prémices-là.
Merci beaucoup. So I will try then to sum up briefly what Professor Yapokrizo said. So I mean, one of the important words is also about promoting immunology, because the young people now, they are not that interested in immunology. So we should promote Immunological Society in different countries and then bring them into the stage. And then the other thing is we need to also teach vaccinology to people. They need to understand how vaccine work, how you design vaccine, and even how vaccine work in the host. And then about my question, so she meant that we should to tackle COVID-19 pandemic or future pandemic, so we should work together, because although disease there need multidisciplinary response, which means everyone should find its place, its function into that. So immunologists, virologists, so everyone should collaborate together to find really rapid and efficient response to such pandemic, and then to be prepared for future pandemic. Maybe one last question. We still have some question in the chat, I think so, but then maybe one more. Yeah, so we need to move on. But then for Patamba, so I have a question for you about and also to Dr. Marakalala. I mean, Dr. Chibwana has another meeting and then she cannot stay with us till the end. But then what about new variant right now? So this is also a threat coming soon, right? Because of the climate change, and so we should envision having even more pandemic and even more variant of viruses because of climate change. And so what do you think, Professor Ngom, whether we are already prepared for that, or do we need to change our strategy to develop vaccine and then learn in another way, or we keep with our RNA-based technology vaccine, and then we say, okay, we learn enough from that, and then we can then tackle future pandemic, new variant. How can we already envision new variant and then prepare vaccine for that?
Yeah, well, good question, and it's a difficult question to answer. Not being a COVID-19 expert, but I know that the variants are a real problem, because the vaccines are as good as the variants, the ability of the variants to evade them. And I think that will be a conundrum that we have to probably live with for the future. But I think all these challenges just make us better immunologists. Unfortunately, I don't have much expertise on that area. Perhaps somebody else can help with that.
Okay, so I mean, Dr. Marakalala, what do you think about that? Because new variants surge from South Africa, right? And then, so what do you think? How are we prepared now to tackle a new variant? And how did we learn enough from COVID then to design new treatment, new vaccine for a new variant?
Yeah, so first, in the context of SARS-CoV-2 variants themselves, luckily with evolution, some of these viruses, as they mutate more at the sites, like the spike protein, that's also the site that they use to attach, for instance, to ACE2, which is a receptor on our cells. So eventually they mutate more that they may not even be able to enter our cells to thrive. And that's where actually future variants would just be fading away, luckily evolutionarily. But amongst those kind of circles of evolution, there could be a chance that there's one that may be severe, like we saw in the case. Because reality is that with passing viruses around, there's so many mutations happening. So, and that's where maybe with lack of evolution we survive. But you're right, we need to understand dynamics of areas of the viruses that are prone to mutations that may lead to new variants. And when we design vaccines, we need to take into consideration vaccines that would neutralize areas that may be mutated too. But also there are a lot of lessons that we learned in addition to just SARS-CoV-2 itself. So first, I mean, like, as we are in the post-COVID kind of era, although someone in our group actually tested COVID last week, it's a sign of that, and we seem to be fine so far. So there are also dynamics that tell us that, like even the infectivity that we're understanding with earlier sort of variants actually seem to be also changing. So there's a lot to understand that goes into long COVID. Long COVID, basically, many people don't have the virus, right? They no longer test positive, but the effects might be the host itself. Does it mean if people are going to do years of research, what's happening to organs, what's happening to inflammation, their state actually, because some of them is too much fatigue at neurological level. I saw Dr. Ketolo mentioned the question of how actually neurological diseases are being sort of affected by the context of immunology. There's a lot of infections like TB meningitis, which might be neurological, but actually emanate from earlier infection. So those dynamics need to be understood. And finally, I wanted to add that there's opportunities, basically, having suffered from the surge of COVID-19, the scourge of COVID-19, we can actually draw inspiration when we tackle other future pandemics or current diseases like TB. I mentioned we only have one vaccine that's over 100 years old. With COVID, we knew that if governments can work together, there could be communication to populations every day. There could be case tracing. There could be like a quick responses in terms of pharmaceutical kind of interventions, developing vaccines and testing them quickly. Of course, we shouldn't compromise quality when you deal with that, but it shows that with commitment, with urgency, with governments putting special funds and also calling for emergency, we should have that with HIV, we should have that with Ebola, we should have that with TB. And if we manage, we'll definitely deal with it the way the world dealt with COVID and the way Nigeria dealt with Ebola. So I think we are now more empowered, having suffered from COVID, but we are more empowered to tackle future emergence of outbreaks. Hopefully there isn't much of those outbreaks. Thank you.
Great work. Yeah. I mean, so you just step in and then already just sum up what I wanted to say, because we are now finishing with the post-COVID discussion. So really, thank you, Dr. Marakalala. This is really fantastic. And then I think one thing that I just wanted to add before I pass to Mambu for the final closing word is, so we need to design unit really to tackle future pandemic. And then this is a fantastic idea from Morocco that we learn now. I did not know that. So this is a really fantastic idea. And then really I appeal here for people to collaborate with this unit so that we are better prepared and then find a new strategy and understand a bit more such virus mutation and so to tackle future pandemic. So I will now pass to Mambo for the final words. And as Patama already put it in the chat, so please submit abstract to the upcoming IUS and FAIS meeting in Cape Town. Gonna be a really great congress. So, and then there are also a waiver for LMIC students. So please submit your abstract and then to be there. We'll all be there to learn more even about the virus and so. Thank you.
Thank you,
Fabian, for mentioning that. Yeah, please share it in your networks.
Yeah, before concluding, I would like to give to Abdallah for...
Yes, very quickly. Actually, that was a very exciting, meeting. I put actually my email address belonging to this new center. I put my name and also my email address, related to this new center. So if someone wants to get in touch with me in that context, a really exciting meeting, and I hope we will organize, soon a face-to-face or other meeting. Tomabu, we count on you, huh?
Absolutely. Okay, thank you very much, everyone, for your time and for the really exciting and interesting discussion. I would like to thank all the panelists for expertise and the participant for asking some valuable and interesting questions. We have a lot of students and postdocs assisting to this meeting. I would like them to keep in touch with us, to keep in touch with Abdallah, who is proposing a really interesting, exciting collaboration opportunities. And I would like to thank you for your time and for your contribution. I will leave Patamba, who is the president of the Federation of African Immunology Society, say some final words.
Thank you very much, Tomabu and Fabien and the Benin Society. We are really proud of you. I think if we have a couple more societies that are doing the same kind of activity, Africa would be would not only be surviving, we'll be flying. So please keep that spirit going, and also make sure you have a succession plan. When you go, people need to take your place to train those people from now. That's my message for you, and thank you everybody else for joining us. Please submit your abstracts for IUIS 2023 and look out for the FAIS 2024 Congress. I see a lot of very smart people on this meeting, and I hope they're engaging with their local immunology societies. That is very vital for you to not to be included in that bigger effort from your countries. And I hope I'll see you all in Cape Town. Thank you very much.
Thank you, President. Like, just one word, like you mentioned South Africa Congress coming. I will also maybe plead for people which are African and are students, but which are abroad, because most of the time when we have this opportunity and we try to apply, because I faced this several times, unfortunately, we are in Europe already or USA, and then we are not able to apply because the travel grants are mostly specific for people still live in Africa. And being in Europe doesn't mean necessarily that we have the financial status to be flying and traveling by ourselves. So please also introduce, this in the big stage for us to help us also. Thank you.
I think we have the president here, so maybe I will continue the discussion in the FAIS ESCO. We have the general secretary of FAIS. So these are the right people to talk to.
Exactly, reason why I take the chance. Thank you so much.
Definitely, I agree. And I put a thing on the chat to say, Tomabu, you should collect email contact lists of everybody on this call, and so that we can reach out to everybody, engage them.
Okay. No
Thank
problem.
you.
You're welcome.
Thank you very much. Thank you all.
Bye.
Bye.
Bye-bye.
Thank you so much. Bye-bye.
Bye. Thank you.
Bye.